Good afternoon, and thank you everyone for joining the Sustainable Floridians program. I'd also like to thank the City of Key West and the University of Florida's Extension Service for bringing the opportunity to Monroe County for its residents to become Sustainable Floridians. My name is Vicki Boguszewski. I'm here to speak to you today about the health impacts of climate change. I hold a bachelor's degree in cultural anthropology and a master's degree in public health. I've been a resident of Monroe County for the last 18 years. And as you can see from the slide, I serve on several advisory groups related to climate change. Consequences of climate change, such as flooding, heat waves, and increased frequency of extreme weather events, can create both direct and indirect impacts on human health at the individual and population levels. Environmentally related illnesses, injuries, and deaths are direct impacts of the consequences of climate change. Direct injury and death can result from extreme weather impacts such as hurricanes, tornadoes, and superstorms. We also see increased incidence of respiratory failure and respiratory problems such as COPD and asthma, related to increased frequency and duration of periods of extreme heat and drought, as well as higher concentrations of pollution and higher temperatures. Additionally, we do see an increase in prevalence of heart attacks and strokes, and we anticipate that this trend will continue in connection with increasing high temperatures and prolonged periods of heat-related weather extremes. The indirect impacts of climate change are a little less obvious, but nonetheless as realistic and as threatening. Higher water temperatures encourages bacterial breeding, and the possibility of waterborne infection increases. Vibrio, for example, a type of bacteria found in the marine environment, breeds more rapidly and more effectively in warmer water. This bacteria has been associated with cholera, gastrointestinal illness, and serious, if not fatal, wound infections. CDC also notes a relationship to more frequent toxic algal blooms in warmer waters. These algal blooms are associated with the bioabsorption of neurotoxins. Bioabsorption can occur in one of three ways: through the respiratory system by breathing these contaminated air particles, through the skin because water touches the skin and has these neurotoxins in it and it's then absorbed, or through consumption. Fish that have been swimming in waters that are contaminated with this algal bloom can then transmit that to humans who eat those fish. The CDC has identified 11 primary health impacts related to climate change. Each of these is impacted in some way by environmental factors. The collection of past and current health data, particularly health data related to environmental conditions, gives us a picture of where we are now, or a baseline for comparison as we plan for sea level rise in the region. The counties within the compact are incorporating climate change and energy elements into their short and long-term planning documents. A health impact assessment of the Regional Climate Action Plan aimed to prepare those counties to also be inclusive of health data and health impacts in those planning documents. Health effects in South Florida. As American communities, those in South Florida enjoy great public health. Planning and preparedness are essential to sustaining that. Saltwater intrusion can cause backlash of pollutants and contaminants into local seawater and can compromise the quality of municipal water supplies. Rising seas can also create areas of standing water, particularly after high tides or storm events. Standing water can be a route for many negative health impacts, including bacterial and parasitic infections, injury hazards, The growth of mold and fungus on buildings and other materials is directly linked to allergies, asthma, and other respiratory illnesses such as COPD. And the mental and behavioral health issues associated with climate change range from stress related to economic vulnerabilities, such as changes in fishing and tourism industries, to the mental stress and behavioral stress of dealing with the rising costs of mitigation. Also, after extreme weather events, stress within communities is shown to be at elevated levels for many years. Options and opportunities. Adaptation implies changing to meet new conditions. Adaptation planning then implies changing to keep up with changes. Mitigation is the prevention of future impacts. Adaptation planning now will be key to mitigating future negative health impacts in Southeast Florida's population. Therefore, building not 1 foot above flood, but 3 to 5 feet above flood may prevent future asthmatic, allergic, or COPD triggering conditions. Consistent leadership within and from the compact keeps these issues as top priorities for the compact counties and provides opportunities for incorporating sea level rise into regional and local planning documents. Coding of data by environmental causes. The use of the ICD codes, or International Codes of Disease, is common practice amongst healthcare providers. Currently, ICD-9 codes are used, and later this year, healthcare providers will be transitioning to ICD-10 codes. There is a specific set of codes within the ICD-10 and ICD-9 codes that are related to environmental causes. The use of ICD codes for environmental causes will enhance the type of data we're able to access and serve to improve our ability to plan for and address changes and trends. Regional responses in Southeast Florida. Monroe County is represented in the BRACE program, which is Building Resiliency Against Climate Effects. This is a statewide localized program in partnership with the CDC, based in the CDC's Climate Ready States and Cities initiative. BRACE examines health impacts and potential responses related to drought, hurricanes, extreme heat, flooding, wildland fire, and sea level rise, among other climate events, through the lens of applied climate science to predict health impacts and prepare flexible programs. The Southeast Florida Regional Climate Compact has been hailed as an example of regional collaboration. It was founded in 2009 when the 4 counties recognized the need for a coordinated response to the climate crisis. The health impact assessment was conducted in 2014. Public health leaders recognized the relationship between policies and community health, and it was noted that the health effects were not a big part of the climate conversation in regional efforts, and at best they were limited to side discussions. This health impact assessment determined the impacts of the recommendations of the Regional Climate Action Plan and made recommendations to the 4 counties so that health data could be more inclusive in their planning. The Kresge Grant for Sea Level Rise Mapping and Modeling Project is designed to produce localized action guides for communities based on models of sea level rise impacts. The Marshall Foundation for the Everglades hosts an annual sea level rise symposium and invites speakers from around the region to discuss the impacts of climate change as it relates to their work. Thank you very much for your time and attention. I hope you will take advantage of the resources that I've placed on the slide here before you. Also, you will find my contact information here. I'm happy to further this discussion with anyone who's interested or to offer presentations for other groups. Thank you very much for your time. I hope this information will support you on your journey to being a sustainable Floridian.